My name is Dr. Tom Nguyen. I'm the Director of Minimally Invasive Valve Surgery and the Chief Medical Executive of Baptist Health Miami Cardiac and Vascular Institute. What drove me in medicine really started in grade school when I had a chance to really witness the very intimate relationship between a doctor and a patient. I would often take my family members and my aunts and uncles to the doctor's office because I spoke English and they didn't. And it was amazing trust that the patients give to their doctors. Then I went to high school and I realized that you could use science to do things to really help patients get better. And I began to become hooked to medicine. My areas of expertise is minimally invasive valve surgery and also transcatheter technology. So I believe that small incisions do make a big difference and patients do recover a lot faster if we can make the incision really small. I'm also a believer in a lot of the transcatheter therapies like TAVR and MitraClip, and I've been involved with most of the major landmark trials in the transcatheter space since the very beginning. The benefits of minimally invasive surgery really are severalfold. One, the most important is a faster recovery. What we do is we try to get patients back to their day-to-day life, back to their loved ones as soon as possible. The other data shows that patients have a lower incidence of blood transfusion, they spend less time in the ICU, they spend less time on the ventilator. There's a lower incidence of postoperative atrial fibrillation if we're able to do it minimally invasively. In the old days, and even now, most of the time we enter the patient's chest via a sternotomy, dividing their breastbone, and that gives you full exposure to the heart. The thing is that most of the time, we don't need full exposure to the heart, so we could sneak in through a small incision and fix what we need to fix. The disadvantage of the sternotomy is really just time to recovery. It'll take longer for patients to get back to their normal day-to-day activities. They'll be in the hospital longer. There's data that show that they have a higher incidence of needing blood transfusions, being on the ventilator longer, and being in the ICU longer. So for us, it's a no-brainer that if we can do it minimally invasively, we should. Most of the time when patients come to us, they have symptoms. So the most common symptoms are chest pain, shortness of breath, or fatigue. The problem is that oftentimes, by the time you get symptoms, it's too late. My specialty is valvular heart disease, and we pick that up with murmurs. And I would argue that if you have a murmur, you should probably get that worked up because there's a possibility that that could lead to eventual heart failure. It's an insidious process where it might happen, you might not even realize it. So it's so important that you try to get to a doctor and maybe get to your surgeon before you start having those overt symptoms. When patients come to us, it is a very intimate relationship that we follow with them throughout their entire journey. We pride ourselves on being available. We pride ourselves on making sure that the patients know as much as possible about their condition and how we treat it and the various options. I'm a big believer in communication and accessibility. So for all my patients, they have access to my email and they can email me absolutely anytime and I'll reply back usually within 24 hours. I think my most important attribute is perseverance. As an immigrant, that word perseverance really embodies my life's philosophy. I've always been a believer in treating patients like family and really kind of always been a believer in the underdog story, the David and Goliath story, and in many ways. With that, I think that's important because that translates to my patient care, and I think the philosophy and the ethos of the Baptist Health System, in that we really fight for the underdog. You know, for those patients who other hospital systems, other physicians have given up for because they're too complicated and they're not sure what to do. Those are the patients that we welcome to come to us, and we will embrace it and make sure that the patient gets the absolutely best care possible and make sure that all the best doctors are there to take care of these patients.